There's 5 key principles that guide what trauma-informed care is. So the first is safety, and that means creating an environment that's both physically and emotionally safe. And this goes for the patient and for the physician. So we want to make sure that everyone feels safe, everyone feels that they have the ability to leave at any time, that they do not feel held against their will, and that they feel able and willing to voice any concerns or questions that they have without fear of judgment or blowback, or any sort of negative reaction. The second is going to be trustworthiness and transparency, and these go hand in hand. So we need to be honest about what we're doing and why. We need to give people all of the information, and give them that information up front so that there are not any surprises and everyone feels that they have all of the information they need to make a decision. And that's number 3, choice. So always, anything that we do in a medical setting, the patient has a choice to do or not do. And there may be some consequences to choosing to do or not do something. And it's important for them to have that information as well. But it always is a choice. There's never anything that should be forced in a medical setting. And so it's important for us to be keeping in mind that the patients do have a choice. Number 4 is collaboration. So this means we're working with the patient to meet their healthcare goals. We're not doing things to them to meet our own goals. And so everything that we do is a collaboration between the clinician and the patient. We are working together to meet the goal of making that patient healthier, have better quality of life, better well-being, all of that. And so we are working together. It's a partnership. It's a collaboration. And then the last is empowerment. So this means that we are supporting the patient in making an informed choice and having the autonomy to do so, and also the empowerment to be able to do other things to help take care of themselves. So they're not so dependent on a medicine, a surgery, a procedure, whatever else it is. We're giving them all of the tools so that they can take that back to their regular lives and improve their own outcomes. So empowerment is very important as well. And so we're integrating this into every visit. And when we do that, we are reducing re-traumatization and we're building a true partnership between the clinician and the patient.